This election has so many serious implications for reproductive health care. I see that we have the flyers about the new HHS regulations where doctors and pharmacists can opt out of providing very vital health care information about reproductive health care services because of their religious beliefs. And now, many of you that are here from Mississippi remember that we passed this same law in 2004. So we actually already do that here in Mississippi. In 2004, 2005, we began receiving numerous complaints from women who would get a prescription for birth control pills and would have to find a pharmacist to fill it because pharmacists would say, I don't believe in birth control, so I'm not going to fill this prescription. We actually did a survey in Jackson and uncovered and exposed those pharmacies in Jackson that actually allowed their pharmacists to opt out of filling the prescriptions that were sent over by area physicians. And so we know we've already had that here in Mississippi, but these federal regulations give support and give validation to the bad state law that we're so famous for passing. A lot of people don't understand how important the state of Mississippi is, and the entire South is. The very conservative and anti-choice policymakers use the South as an experimentation for what they want to do all over the country. And so when things pass here, people often give up on Mississippi and say, well, we're not going to win here anyway. But what's important to understand is if it passes in places like Mississippi, South Dakota, then it can definitely pass nationwide. So we need to really, really pay attention to what happens here. We can't give up. We cannot give up the fight. So, yeah, so this election carries some very serious implications about the future of reproductive health care and health care in general for all families. Who's going to get appointed to the Supreme Court if any of the current justices pass? That's going to have tremendous impact on the future of Roe v. Wade and our ability to make our own choices about our bodies. During this current administration, we saw a doubling in the funding for abstinence-only programs throughout the country, most of whom are religious-based and give young people medically inaccurate information about reproductive health care. And so we've seen in Mississippi, as these programs have increased, the numbers of teen pregnancies and STDs have not. So these programs have been proven ineffective around the nation, especially here in Mississippi and in the Mississippi Delta, where we have very limited resources for women's health care. What do we want? We don't care whether or not our government believes in abortion. We don't care about that. But we want the government to stay out of our personal decisions, regardless of what they believe. We want the government to stay out of our personal decisions, stay out of our bedrooms, so that we can make our own decisions about our lives, our bodies, with the support of our families, with the support of our faith, and with the support of our physicians. That's not a government choice, that's our choice. And we're smart enough to make it. We don't need the government's help on that. So we also want support for real sex education in our schools and in our communities. We want increased funding for family planning. We want to protect women's health and rescind the Hyde Amendment, which takes away federal funding for abortions.